Good afternoon, everyone. Before we get started, let me introduce those who have joined us today, and I'm going to take them in order of seniority. Congressman Danny Davis, Congresswoman Jan Schakowsky, Congresswoman Robin Kelly, Congressman Raja Krishanmoorthi, Congressman Sean Casten. We also welcome Sheila Roberson, who is a Medicaid enrollee and has joined us. Debra Carey, of course, our interim CEO. Andrea Gibson, who's our interim chief business officer for the health and hospital system. Aaron Gleaner, who's interim CEO of County Care. And Dr. Whitney Lynn, a family medicine physician who practices at Providence Hospital. So, did I miss anyone? Got everyone?
And translating.
And translating, thank you. Michael Albert, I'm sorry, yes, I always introduce Michael. Oh, he's a constituent? Yeah. All right. Michael Albert, who is our sign language interpreter, and more important, a constituent of Congresswoman Schakowsky. I stand here today, much as I have throughout the course of the last several years, to talk about an issue that impacts vulnerable populations. We've talked about gun violence. We've talked about the economy. We've talked about opioids and job training, food and housing insecurity, racial and health equity. But today, the stakes are higher. What is before the Supreme Court isn't just a portion of the Affordable Care Act, it's the entire Affordable Care Act. The very Affordable Care Act that led to 20 million Americans being covered with health insurance. The very Affordable Care Act that allowed Illinois to expand Medicaid to a new population of adults without dependents. The very Affordable Care Act that provided subsidies to those who earned slightly above the Medicaid threshold and enabled them to access coverage on what is known as the marketplace. The very Affordable Care Act that allowed us to cover our kids until age 26. The very Affordable Care Act that required insurance companies to provide preventive medicine and to cover pre-existing conditions. The very Affordable Care Act that covered mental health and substance use disorders, and the list goes on. This was life-changing. It was progressive. It was stabilizing. It was a decision that made it possible for millions of Americans to achieve health care. And here we are, 10 years later, at a moment no one ever expected. Instead of talking about extending coverage to those the ACA left behind, we're talking about repealing the law altogether. Let's be clear what this is about. The Affordable Care Act was a piece of legislation that has improved health outcomes, balanced some of the health and racial inequities that we see in our country, and given individuals the dignity of coverage and the power to improve their health. Let's take a quick look at how the ACA changed Cook County health. In March of 2010, the ACA was signed into law with an effective date of January 1st, 2014. The law provided states with the ability to extend Medicaid benefits beyond the traditional populations of mothers and children and disabled, and those who were disabled, to include low-income adults without dependents known as ACA adults or Medicaid expansion adults. And Illinois then agreed to extend Medicaid to this new population. In 2011, Cook County, through the state of Illinois, applied for a federal, what we call 1115 waiver. The waiver was granted to the state of Illinois in October of 2012 and allowed us to create county care and to enroll ACA Medicaid expansion adults into county care. Let me take a moment to thank our congressional delegation for their support and assistance in getting county care off the ground. I'm grateful to all of you. Thank you. Today, County Care, not one of our commercially owned plans, but our publicly run health plan, is the largest Medicaid managed care plan operating in Cook County, with more than 370,000 members. A repeal of the ACA would impact 94,000 of those members and another 214,000 members in other plans. The repeal of the ACA would almost certainly lead to more hospitals closing their doors. Here's the bottom line. The repeal of the ACA would not only financially cripple Cook County Health by dramatically increasing the amount of uncompensated health care we provide, it would be catastrophic for the patients we serve. And in a moment, Debra Carey will outline for you the financial impact. But let me say that we've been down this road of appeal before, and rational minds have always prevailed. But we're at a different point in our nation today. I have great concerns that the repeal of the total law, rather than a piece here or there, is a very real threat this time around. It's a threat to this hospital and to its long-standing history. And it's a threat to our patients, and quite frankly, it's a threat to the belief in this country that we must do everything we can to support our people. We must do everything we can now to uphold this law. Now I'd like to turn over the podium to Debra Carey, our interim CEO.
Thank you, Madam President. Good morning and welcome to Cook County Health. As was stated, I am Debra Carey. I'm the interim Chief Executive Officer for Cook County Health. I first want to begin and join Madam President in thanking the elected officials who have joined us today. And I also want to thank them for their unwavering support of this health system and because of that support, for our success. And I'd also like to thank Mrs. Roberson, who is here today as the face of the Affordable Care Act. And thank you so much for trusting us for your care. For those of you who don't know, Cook County Health is one of the largest public health systems in the nation, and it has served as a safety net for health care in Chicago and suburban Cook County for more than 180 years. And for the past 10 years, Cook County Health has been transforming the provision of health care by promoting community-based primary and preventative care, developing a robust collaborative health insurance plan, and greatly enhancing the patient's experience, but also enhancing the patient's access to care. The Affordable Care Act has been integral in that transformation. It allowed us to build County Care, our own Medicaid health plan, that has grown to be the largest in Cook County. County Care has provided coverage and thus reimbursements for care for previously uninsured individuals. And I might add, it also has helped stabilize certain other safety net hospitals within Cook County. In fact, Cook County Health has been able to withstand a 75% decrease in local tax support to fund its own operations since 2009. We've gone from $481 million to $83 million this year, in large part due to the new revenues available as a result of the implementation of the Affordable Care Act. So that is a direct savings to the taxpayers. The potential for repeal of the ACA will be devastating to the patients we care for and will put the fundamental mission of this organization in jeopardy. As Madam President said, of the 370,000 members in our Medicaid managed care health plan, County Care, some 94,000 are ACA adults who became eligible for coverage because of the ACA. All 94,000 in our health plan and the other 214,000 Affordable Care Act adults who are in other plans risk losing this coverage. That's 308,000 individuals who are currently enrolled in Medicaid who risk losing their coverage and becoming uninsured if the ACA is repealed. Those who lose their coverage may have no other options for alternate insurance coverage. They may be forced to discontinue medicines for chronic diseases such as diabetes and heart disease. Many will go back to relying on local emergency departments for basic health needs or waiting until they are acutely ill to seek care. And we've seen the impact of waiting for care during COVID. A much more costly way to receive care is within the emergency department and waiting until it becomes more acute. They will not be insured as we continue to respond to COVID-19 or won't be insured for the next pandemic. This is yet another hit on Black and brown communities who disproportionately comprise the Medicaid population in Cook County and who have experienced the most negative outcomes from COVID-19. But if the impact on people's lives doesn't resonate, perhaps the financial impact will. Should the ACA be repealed, the projected impact to this health system, Cook County Health alone, would be $1.4 billion. Take a moment, let that sink in. The impact to this Cook County Health system alone would be $1.4 billion. You see, we would be losing both reimbursements and we would be gaining additional expenses because of the uninsured we would be forced to care for. Let's look at the revenues that may go away under a total repeal, just to give you a little bit more detail. The lost revenues for those 94,000 Affordable Care Act adults in county care comes to about $600 million. Cook County Health also gets reimbursed for the care we provide to Affordable Care Act adults enrolled in other health plans. Our conservative estimate is that that loss would come to another $100 million. And the third number in our projection is related to charity care expenses or uninsured expenses. If we continue to provide half of the charity care in Cook County as we do today, and assume that that same proportion under repeal, then half of those 308,000 ACA adults living in Cook County will now turn to Cook County Health for services. That adds expenses in the neighborhood of $700 million. So the $1.4 billion calculation is our current revenue from the health plan. Providing care to ACA adults and the expenses should just half of the population look to us for charity care. This $1.4 billion number does not include any projections around the number of individuals currently enrolled in a marketplace plan that would also lose coverage. It also does not count those under 21 who will be thrown off their parents' coverage, nor does it include those with pre-existing conditions who may not be able to obtain coverage. Many of these individuals are likely to turn to Cook County Health for their health care as well. And then there is all the good work that we have done with the net proceeds from the health plan, from our county care plan. We have taken any dollar that we didn't have to directly pay for that patient's care and reinvested that in mental health, in dealing with the opioid addiction, providing housing, dealing with food insecurity. These investments were made possible largely because of the ACA. They too would go away. This is a real threat to Cook County Health. The progress that we made under the Affordable Care Act and also the people that have been served by it. But in the end, should the Affordable Care Act be repealed, it is our patients who will be most impacted. Their ability to access preventative care, get the mental health that they need, services that they need, and substance abuse treatment, and also the medications that they need, will be stripped from them. They would go back to the days of having to choose between food for their families or medications they need to stabilize their health. These are not choices that any human being should have to make, no less a human being living in the richest nation in the world, in the middle of a global pandemic, which has illuminated the racial and health inequities once again in this country. Repealing the ACA can't be seen as a political victory or loss. It must be seen through the eyes of individuals who do not know the security of having health insurance. The ability to have a doctor to go to for the common cold or to the pharmacy for their insulin, or through the eyes of the individual who once had to ration their heart pills to pay rent. It is the mission of this organization to provide health care to those in need. But as the interim CEO, it is my responsibility to tell everyone that our mission is at grave risk should repeal happen. I don't think there is anything more fundamental in this battle for equity right now than health care. To those elected officials and others who would allow the repeal of the Affordable Care Act, you are choosing politics over primary care, rhetoric over responsibility, and heartlessness over humanity. We have the experience of COVID-19 right before us as an example of the havoc to our lives when politics overrules what we know is the right thing to do. Thank you so much.
Thank you very much, Deborah. So the custom is that we recognize people in order of seniority. Danny and I served together for a short period of time in the city council before he went on to bigger and better things. First as a county commissioner, and then as a member of Congress. And this is actually his district, so it's especially appropriate that he speak to us first. Thank you.
Thank you very much, and I am pleased and proud to be here standing in the magnificent complex with the tremendous Cook County Hospital and its health services. I want to thank President Toni Preckwinkle for convening us and bringing us together. As I walked through the waiting room and saw individuals sitting there socially distanced, waiting to see their physician, to see their doctor, go to whatever clinic or service they were going to, I felt so good because it was so different than the Cook County Hospital that I first knew. It is so professionally run, such great services that those who have the least in our society can come and know that they're getting the same care that others might be getting at a different institution. And so I would just hope that the Supreme Court would understand what the Affordable Care has meant, what it continues to mean. Just to think that more than 20 million people who did not have access to health insurance and health care now have it. That individuals, the Affordable Care Act has been the best thing that's happened to health in this country since the mid-1960s, when Medicare and Medicaid were passed to provide an opportunity for poor people, low-income people. As we've already heard, as President Preckwinkle said, if the act is dismantled, if the services are cut, if the money is taken away, it means closure of certain activities and services here. But the only other way to keep it going would be for the taxpayers of Cook County to take up the slack. So I've always had great respect for our Supreme Court. And I just hope that that respect will continue as they make a decision and understand what the citizens of Cook County understand. Thank you very much.
Thank you. Thank you very much, Congressman. I didn't have the pleasure of serving with Jan Schakowsky. She was in the state legislature before she went to Congress, but we have a close working relationship in Washington, and I'm deeply grateful to her for her advocacy on behalf of Cook County, and particularly Cook County Health.
I think I will move this down a little. Hold on. So I would want to begin with a big thank you for Cook County Board President Toni Preckwinkle. I doubt that there is a public official anywhere in the country who worked harder to make sure that the Medicare expansion was included for this hospital, and she did it even a year earlier, fighting relentlessly for a waiver that allowed Cook County Hospital to begin welcoming people into an insurance plan, county care, that would make sure that they would be able to get the care that they need. And as a consequence, 300,000 plus low-income residents became insured, no longer relying on on charity or having no health care whatsoever. And all of the amazing opportunities that were created, that have been created by the Affordable Care Act, can be completely undone if President Donald Trump and the Republicans and their Supreme Court repeal the Affordable Care Act. And you have to ask yourself, what kind of malice does it take to snatch health care away from hundreds of millions of people, making it harder for them because of pre-existing conditions and all kinds of other benefits that they would have had, in the midst of a worldwide pandemic that has already taken the lives of over 210,000 Americans and infected about 7.5 million, and including disproportionately black and brown and low-income people. You know, for 10 years since the passage of the Affordable Care Act, we have been hearing about, from the Republicans, that they want to repeal and replace the Affordable Care Act. Well, absolutely nothing has been done, and though the president says it's going to be better health care, it's going to be cheaper, nothing is on the table except full repeal. Medicare expansion ensured that states would pay no more than 10% of the cost of their expansion under the ACA. And it is estimated by an organization called Protect Our Care that in Illinois alone, that 700,000 Illinoisans will lose their coverage. But thanks, of course, to that, of course, means that if the ACA disappears, we've talked about people with pre-existing conditions, which is about 130 million Americans, may not get covered, and they may need to come inside this door. So it is really hard to imagine anything more cruel, especially at this moment of dire need in this country, that this proposal, now being considered by the Supreme Court just 4 days after the election, would take health care away from all those Americans. And now Donald Trump is saying that there is no relief on the table for all the families that are suffering, the people that are calling our offices, the adults that are crying into the phone, literally weeping, because they are in such dire need of health care, of a job, of insurance, of food. I would say to Donald Trump and the Republicans that support this repeal, you already have blood on your hands. Do not make it worse by repealing the Affordable Care Act. I think these are mine. I think this is mine.
Thank you very much, Congresswoman. Congresswoman Robin Kelly started out in the state legislature and then worked for, I think, Chief of Staff for Alexi Giannoulias, the treasurer of the state of Illinois, and then came for a short period of time to serve as a bureau chief in the county, our Bureau of Administration, our largest bureau, and then, of course, was elected to Congress in a special election. We're very grateful, as I said, for her help and support of Cook County, and particularly Cook County Health in Washington.
Thank you, Madam President. Good afternoon. Thanks for bringing us together. And I want to thank Madam President and the Cook County Healthcare System for saving lives. That is just the bottom line. I come to you as an ex-cooker, as not only the Congresswoman from the 2nd Congressional District, but I'm the chair of the Congressional Black Caucus Health Brain Trust. I sit on the Healthcare Subcommittee for Energy and Commerce, and I'm the new co-chair of the Racial Disparities Working Group. COVID-19 has shown a bright light on racial disparities in healthcare. While the numbers are shocking and the stats are shocking, we are not surprised because this has been going on forever. If there's a repeal in the ACA, we will not go in the right direction. We won't eliminate the disparities that we're trying to do. We will see the disparities increase. I've done a lot of work around maternal mortality. We will see that increase. We will see healthcare increase. We will see diabetes increase. It is absolutely a travesty that we're even here to have this discussion, that we still, in the richest country in the history of the world, that we have to stand up here with masks on and 6 feet apart because we have not taken care of business like we should. Hopefully, those on the Supreme Court, all I can think of, they're supposed to be really smart people, and greater minds will prevail. I want Madam President to know I stand with you shoulder to shoulder, and whatever we can do, that this won't happen. And if it does happen, hopefully there'll be brighter pastures in January, and we can do something about it then. But thank you again for the lives you have saved, and I will be a voice for you. Thank you.
Thank you, Congresswoman Kelly. Roger Krishanmoorthi, I got to know in one of his statewide campaigns, I think. I'm very grateful for his presence here today. He's a friend as well and has always been willing to work with us to champion health care for all, and particularly the Cook County Health and Hospital System.
Thank you, Madam President, and thank you, Interim CEO Debra Carey. I just want to echo one sentiment, which is that there's probably nobody in this country, certainly nobody in Illinois, who's a greater champion for health care for the indigent than Toni Preckwinkle. And she comes to Capitol Hill frequently to make sure that the residents of Cook County, but for that matter, all Americans, are adequately covered by quality health coverage. I just want to talk about a story about one of my constituents. His name is Patrick Malia. He was a healthy 37-year-old who lives in my district in Elgin, and he went to the emergency room early on because he was coughing, running a fever, and having difficulty breathing. Well, guess what? It turns out that he had COVID. To this day, his symptoms persist as he still, even after recovering, suffers from fatigue, brain fog, headaches, chest pain, and shortness of breath. And we still don't know how his symptoms are going to continue. We don't know the science of what it's like to have been afflicted by COVID long term. But what we do know is that if the Trump administration is successful in repealing the Affordable Care Act, whether it's through the Supreme Court or themselves directly, having been infected with coronavirus would become a pre-existing condition. Let me just repeat that. 7.5 million people in this country who had COVID or who continue to develop COVID have a pre-existing condition that could lead to the denial of insurance coverage for themselves if the ACA were terminated. I don't need to tell you what's at stake here. If the Supreme Court strikes down the ACA, people like Patrick and millions of other people are going to be denied vital health insurance. If the ACA were dismantled, the estimates are that in Illinois, 750,000 people would lose their health insurance, leading to $5 billion less in healthcare activity, which means that all of us are affected when the economy shrinks because of it. Finally, I understand that President Trump has COVID. I wish him well. I understand that he is receiving world-class care as we speak. That's a good thing. But the American people deserve no less. The people of Cook County deserve no less. And advocating for the repeal of the Affordable Care Act at the same time that you yourself have COVID, and there's a global health pandemic is just plain wrong. Now, I understand Judge Barrett, who's been nominated to the Supreme Court, actually sits on the bench here in Chicago. So she may actually end up hearing portions of this broadcast and what you and the media are conveying today to the citizens of Cook County. If she's listening, and if she has a chance to sit on this very case, I hope that she understands that the stakes could not be higher, not only for the 7.5 million people who have COVID or who had it, but for the hundreds of millions of people who rely on the vital protections of the Affordable Care Act for themselves and their family. Thank you.
Thank you, Congressman Krishanmoorthi. Last but not least, Congressman Sean Casten. Sean is part of the distinguished 2018 class in the House of Representatives. I am very grateful to him for his good work over the last couple years. And I know you're in a tough race for re-election. We're going to keep our fingers crossed.
Thank you, President Preckwinkle, and thank you all for coming. Look, I think we all know what's at stake here. If the ACA is repealed, bans on pre-existing conditions, coverage for people with pre-existing conditions goes away. The insurance company's ability to not provide you with coverage for preventative care goes away. Caps on insurance rates for seniors goes away. Medicaid expansions go away. Those are all kind of policy wonky things. But let me put some hard numbers on this. When Mitt Romney created Romneycare, the program that was the model for what became the ACA, for every 1,000 people who got covered, the annual mortality rate fell by about 1.1% decline in annual mortality. When the ACA was rolled out, those states that took the Medicaid expansion compared to those that didn't, we had a direct experiment, and we got about the same number, somewhere between 0.1 and 0.3% reduction in mortality. If the ACA is repealed, 23 million Americans will lose their health insurance, which means that we will send 20 to 60,000 Americans every year to their premature death. That is what is at stake. Those kind of numbers may not matter to a president who's already been responsible for killing 210,000 Americans from COVID. They may not matter to the enablers and grifters who surround him. They may not matter to a president who didn't even see fit to protect his own children from the virus that he couldn't keep himself from getting because he denied to acknowledge science. But they matter to me. They matter to all of us who are up here. They matter to all the folks who are sitting downstairs in that lobby wanting to make sure that they have care, not the care that they can afford, but the care that they need. Those are fathers and mothers and sons and daughters, Republicans and Democrats. They are all Americans. And if they don't matter to the president, if they don't matter to some number of justices of the Supreme Court, hopefully not a majority, but if they don't, shame on them. If they break this law, we will have no choice in the 117th Congress but to fix it. I would rather we spend our time expanding our health care than cauterizing self-inflicted wounds, but if that's what we must do, we will. Please don't break this law. Thank you.
Thank you, Congressman, for those powerful words. Next, we'd like to hear from Sheila Roberson, who's a patient in our health and hospital system and a county care member.
Thank you. Thank you, President Preckwinkle, for being with us and talk to us today about this important issue. My name is Sheila Roberson. I am 47 years old, and I have been a patient of Dr. Lynn Whitney, Cook County Health, for the past 8 years. I have come here today in the midst of the pandemic to talk about the benefits of the Affordable Care Act and how damaging it would be to be repealed. Everyone deserves access to affordable, quality health care. It is basic, a human right. I have been a patient of Cook County Health for a very long time and get my care at Providence Hospital, which is such an important part to our community. I am a county care member, and because of the Affordable Care Act, I am able to have my annual physical, mammograms, and wellness visits. Because of county care, I have access to preventive high-quality care. If they repeal the Affordable Care Act, I will no longer have access to annual mammograms, flu shots, or a COVID-19 vaccine when one becomes available. Now, especially during a pandemic where people are dying and becoming extremely ill, it is important for us to have the Affordable Care Act. Taking it away would put lives at risk, and individuals like myself would be at a greater disadvantage. We would be able to make our health and wellness a priority, and the Affordable Care Act help us do that before it's too late, and we are far too sick. Thank you, President Preckwinkle, other elected officials, my doctor, and care team of the Cook County Health, shedding these light and issues. Thank you.
Thank you. Whoops. Thank you, Ms. Roberson. We're very grateful that you were willing to come forward and talk about your care. And your physician is Dr. Whitney Lynn at Provident, and a physician in Cook County Health. You want to say a few words? You weren't intending to. Oh, okay. All right. Okay. Nick?
Questions? Yep, I think we have a number of reporters on the line. Let's start off with Brett from the Sun-Times. Brett?
Yeah, hi, President Preckwinkle, could you just address the awesome challenge that your next full-time CEO is going to be facing? We just learned the name of a finalist candidate that needs to be approved by the board. But just coming into a job like that, that's quite, I mean, there was already challenges. Could you just with the ACA at risk, could you talk about the challenge there as well?
Sure. So the question is, what are the challenges that the new CEO will face? Well, it's unclear, of course, what decision the Supreme Court will render in the challenge to the Affordable Care Act. But as you've heard this afternoon, we are all very, very concerned about the Supreme Court action, knowing how much it means to our patients and the physical health of our health and hospital system. Debra, Carey, would you like to speak to this? You're in a better position than I am, I think.
Thank you, President Preckwinkle. Yes, I think, again, it's what we as chief executive officers really consider and are concerned with every day. First and foremost, what we want to make certain is that patients who need care get care. So I think that's always going to be one of the number one challenges, is how do we keep that going? And we do that with having the appropriate staff and also all the appropriate equipment and those things. Clearly, if the Affordable Care Act is repealed, that becomes more difficult to do. So what we want to do is, for us, we really have always looked first and foremost to what are the needs of the patient. And we don't compromise on that. But not having the resources on the Affordable Care Act, as I said earlier, allowed us to go beyond just the traditional health care to deal with other issues that truly impact care, such as housing, such as getting the appropriate food, also dealing with many issues around behavioral health, which over the years was never really covered appropriately, even before the Affordable Care Act, but we've made some significant progress. So I would like to believe that any CEO will continue to try to work on those things, but also with the support of all the electors also, we'll try to make certain that no matter what happens, that we still focus on what are the needs of the patients and give them the best care that they can get.
Brett, did you have anything else?
No, that's good, thanks.
All right. Stephanie, you there? Stephanie from Cranes?
Hi, I'm here. Thanks. My question is also for Debra. Debra, will you continue in the role of Deputy CEO of Operations?
Okay, we'll ask Deborah Carey to answer the question.
Yes, I will go back to my deputy CEO role once the new CEO is on board.
Thank you. And do you have any sort of contingency plans in place if something were to upend county care at this time?
I'm sorry, say it again?
If the ACA were repealed, is there a contingency plan in place as to what would happen with county care?
The short answer is no. We have made it quite clear what our position is, and we hope that our view of healthcare in this country carries the day.
Thanks very much.
Alice, are you there?
Yeah. So my question is for the president. How do you feel about the lack of action from Washington regarding more coronavirus federal aid, and how badly is that hurting the county?
Well, it's profoundly disappointing to all local units of government who have been challenged by the pandemic. Not all local units of government, of course, have a healthcare system as we do, but all of them have had to respond in a variety of expensive ways to the pandemic. And this is not, let me be clear, this is not a red state or blue state issue. This is local government at every level trying to provide services to our constituents. And the federal government is the only entity that has the resources to support all of us, to help all of us on this really difficult moment. So it's profoundly disappointing. We hope that there'll be a change in leadership at the top of this country and more willingness to address the challenges that local units of government face. Next question.
Anything else, Alice?
No, that's it. Thanks.
Ryan, you there?
Yeah, I'm here. Hi, everyone. Just two quick ones. One, for the president, do you know when the board will be taking up the appointment of the new CEO, and when do you expect them to start?
My understanding is that, help me out, Nick, has the name been submitted to the board?
Yes.
Yes. Okay, so it'll be heard in an executive session in committee, and I imagine it will emerge from committee either in October or November. So by the beginning of our new fiscal year, December 1st, there'll be action, I expect.
Great, thanks.
Ryan, anything else?
Nope, that's it for me.
Are there any other reporters who may have jumped on after the press conference started? All right. Brett.
Can I ask one? Can I
Yeah.
ask one more?
Sure.
Yeah, I just want to go back to the patient, Sheila Roberson. I just want to be clear, Ms. Roberson, did you have any pre-existing conditions? And also I was curious if you've had any issues with COVID. Have you had an opportunity to be tested or anything like that? I want to cover my bases here.
Sheila Roberson.
Yes, I had, I was ill. I had my blood pressure and all of that. I had several things done, so that's the best way to answer that. And yes, I've been sick.
Sorry to hear that. Any issues with COVID? Or?
No. Thank God,
thank
no.
You. Good, thanks.